Oman FM, Ash FM, NAP Radio. Any social media platform no so now join here and there oh bibi sonko awon sabeka. Mpanimfo yi Dr. Joseph Akono and afi Dr. Kofi Boahen. Mpanimfo mi no na me no mo eba bedi enkomo. Me din e de ya amofa Boache. Dr. Boahen akwaba. Now what to say? Okay, Dr. Akwaba. Now what to say? Okay, and I say no pay say mo join here. But me fa Dr. Boahen shasi. Obi babuza say Ghana ni okrom de fahin.
Me incarnated me go school ha.
Okay.
But papa free Chibi.
Nsuta Chibi.
And I me free Asokore.
Okay, Nsuta Chibi na chesa santime mo asem na Chibi de oka Chibi ba ko ben hanti no. Na you say wa chiri mu yi Chibi. And na
mama free Asokore Mampo.
Asokore Mampo. Okay. Mmasua mo no also sha say Ghana.
Mr. Sebo Ghana, me go school, Datus Preparatory School, Mubuashi.
Okay.
Me free on I'm called Prempeh College. To me, we at Prempeh College A level 87, and I'm a national service. Me free honor, and I me call Moscow.
Okay.
Because he is veterinary doctor.
Okay.
Me free on me call US.
And you only are Dr. Moseo veterinary doctor.
Me veterinary doctor.
Okay.
Me call US and I'm the
Okay.
And I'm a Sankoye human medicine.
Okay.
And Juana me so me training. Mayo Clinic.
Mayo Clinic.
Mayo Clinic. Ranked actually #1 hospital.
And what state ben?
Minnesota.
Okay.
Minnesota. Na me Dr. Akono.
Maybe Dr. Akono Oceano unim no.
Onim obekan story natural. Me Dr. Akono ye ko echi pa. Service me call Datus. Also call Datus.
Hey.
And he called the same place a free age 4. The kosi echo US. Echo ye training.
The one na mo sha say free kwada brim.
Ye sha say free kwada brim.
Na mo kwa be doctors. Na mo sha say no na wonim say mo mienu nyam be doctors.
No, na ni say they say normal way na say wo course for na hu de hia na hu be your talent wo na wo match nya na nyame de insure go so.
Okay.
Then you forward you.
And it say I can say yes. Oh yeah. One specialize with them.
My first specializing was surgery free or collarbone. Echo with trim.
Okay.
To be specialty no boiling down. Because it's facial plastic and reconstructive surgery.
Okay.
Meaning say obia or she shed normal nim money efe na eye dwumaye. And I face so say ebia wo be if free wo timo.
Okay.
Brain tumor.
Okay.
We say the cohort.
And now you are one of the.
Yes, Mrs. Me Juma was Johns Hopkins Hospital, Baltimore, Maryland. Yes, in the Honor. Yes.
Say you're top.
Yeah, top. You're on phone in the top.
That is from that to soon in the packet. I'm called Dr. Dog. Akwaba. My main your background, Kakram. Because one man for who Nipa Moye and Sunny and Komono Ababe share as say. Most of us say that is.
Yes. Okay. Me training yet
to mix it. You can do the mixer.
Yeah. So I started that with Dr. Boahen. And from there I did my training. I went to Tamasco.
Tamasco Secondary School.
Okay. And then from there to School of Medical Sciences in Kumasi.
KNUST.
Yeah.
Okay.
So me and I call Michiano or Mayo Clinic. Now, me urology.
I don't call Mayo Clinic.
For training.
For training,
yeah,
right.
Yeah. And me spending 6 years training in urology. And I did a fellowship after that at the University of Minnesota.
Okay.
Yeah. And then after that, I joined one of the biggest group specializing in robotics, laparoscopy, surgery. And so that's what I do now.
These are medical terms, strong medical terms. I change so change with the mind.
Yeah. Yeah, no robotics in laparoscopy chair instead say you be well with the long incisions.
Now operation. No?
Yeah, you see keyholes, small holes.
Okay.
Now the instruments are show more.
Yeah, operation.
Now operation.
It reminds me of Honorable Ken Koyen operation. Actually, very uncommon. And she said the operation at near a pipe, no.
Yes.
Oh, okay.
Yeah,
okay.
80% of my urologic practice, mean pipe your beer. No. Through small scopes. So, obi war tumor on the kidney, small tumor. To me, passy be a friend. It says small telescope, all the way from the urinary tract all into the kidney, and then I have small instruments that allow me to pass a laser to ablate those tumors.
I see.
Yeah, and see, that's just one way of dealing with small tumors in the kidney. Sometimes when people have big masses, instead of cutting them up, we do laparoscopy to remove the tumor, depending on the size. And in addition, I do surgery on the prostate, both for benign and cancerous conditions.
Okay.
Yeah.
Using minimally invasive surgery.
Or specialization here specifically.
And so urology comprises mostly the kidney, the urethra, the bladder, the prostate, and the male reproductive organ.
I see.
Yeah.
So, Dr. Boahen, share from her to her. Now we also hear from her to her. And the movie combination. And she said, "We banner from her to her." Then now ordinary ammonia. So we bounce on their hands. No. So now more center Ghana.
You were center of Ghana. Actually, not too far from Bibi Yakasi. You center your friend West Africa Institute for Special Surgery. West Africa because your skill set, Ghana, but a share of West Africa. And or Yarefa.
Are you telling us, say, you share that need West Africa?
So specialty surgery that is focused with the level of expertise, there might be ones that we don't know of, but we are starting from somewhere.
Okay. But explain it, Trey. Also, when you saw cat maybe say will be a problem. You see a cat in
yes, surgery. You say after the surgery, all recover and time now call your normal life. And to see a betra, a betra, a be a wasuechi. And yes, the camera, a be before was soon near the surgery. It may call was soon near the core brain. It may fall him near the core, and they before we near the core brain. And inti baby, I bet me the bed, the camera, ne robot, ne no man, and who do you see, and no, you prefer because Okoyesa surgery now, I did channel go fee.
Oh, sir.
And yes, I'll bet that hospital 1 month, 3 months. So,
Nadia, name my that watching
technology. In the past, no needs tiny cameras. Some person share a demo who met me to be a rap, be a Safwan channel. As long as the camera nation had me the whole room. Before, no, I said, would to a prono, and so with me a room. I did so by we are nice out there for
healing.
No. This is the I say, okay, doesn't make sense. Say, you be a prono answer, you be a sheshe in Kunyana. It made the camera a shimwa. You won't be a
okay.
As long as there's the option to do that, we usually prefer that.
Mobile gun has say any Africa, for that matter, West Africa and Africa. I didn't know observe about the one or specialized woman. I didn't know observe with the Ghanaian people.
So number one, it's a sad thing to see. Say so, be will be a. And say the owner. It is a simple example. Nkolabi or from Salmonia cleft lip. You war no, apai, right? US no say omundi 3 months and a year. First time I'm about Ghana say maybe year 2004. Me who be away 15, 20, 34 yeah. So I said it take 30 minutes. Yeah. And so one of the things that me who said I don't for some reason no. So you be a chance of being a doctor baby. So by that time now too complicated or too late. So that's one of the observations.
Okay. Now Obi Babusa say answer the bebano. Say was saying if you see an okra and son or be one. Yeah, the ban.
Okay. No maybe what wait me prevent it. So my minimum or some vitamins or mufa to reduce risk of some defects. Maybe also you don't have any control, it just happens.
Okay.
In normal bit ma prevented here, prevent it. So for example, see you can say and red meat too much, open your kidney stones are. That's how they no one or pay. No your kidney stone one or yeah. Right, but with my prevent here, no, not to get the kidney stones, you do it. So there are certain things that the way your lifestyle, normal would or exercise, but me what avoid this injury. No, other things that you don't have control.
Okay. Before I call Dr. Kono, more establishment na a both and now be our day.
No, it's one place. It's a very, very beautiful place.
Okay.
Yarifa. Or Yarifa, you were 4 operating rooms, modern operating rooms, a surgery. You were clinic, a very spacious, catered towards family. So, oh, baby, when you are, you will do family bar. No more tenacity, near Boncomo, near who said, you show your wine the better will feel. So, it's part of a holistic approach. And you will be uncomfortable me that say, yes, surgery, we are, or be out in the private room, and yes, you will need 20 Falco. So that's the facility.
America will give you more money. Why? So I decided say you want to come and practice in Ghana.
Okay. A value system and a be impact factor. Says honey oye, a honey tete, that was near koye, right? Na say nyamia boy ni nya kwanye to kwanye ko school any skills are. Omo ye share omo ebi mo ha mo free royal family Saudi Arabia no mabe hu na we free Qatar no aba no we free California no aba
say no dey cash in the bank.
Yes, cash. But say you can say oh Dr. Boyne omo ye hu omo wi omo ka say into who free he let me say free Ghana just say you successful na say metimi ahwe Americans, British, Qatar omo free Qatar, Saudi na say be krom de bibi to omo na say omo nya emwana then my success is incomplete.
Okay.
And into the world.
This is moral.
Yeah.
I see.
Yes.
I see. Dr. Akono, explain to us. Also, so baby ocean. So the pelvic that say on ocean. Explain to us. Oh, by what observe baby from the Ghanaian community.
Yeah, and one of the biggest things that I've observed is people are coming to see urologists very late.
Very late.
Yeah. It looks like we all just adjust to the symptoms. So let's look at the urinary tract. There's something called a prostate that every man has. And as we get older, it gets bigger. And so what tends to happen in most men is that it starts to cause some restriction to our urination. Yeah, so you have some difficulties, like we'll call bathroom more frequently, or you have a lot of urgency. Urgency didn't mean it's we feel this sensation says to mean control.
Yeah.
And those things are all signs that something is not right. Yeah. There are a few things that when you do, like you drink a lot of water or you drink a lot of coffee, that will cause that. But usually not the case. Usually not the case. That's right. And those are the things. So the actually saw a patient yesterday who waited till one day he woke up and couldn't urinate. And they had to go to the emergency room for them to put a catheter in. He's had a catheter now for 5 years.
Eish.
These are all things that.
And is there no way out? Find catheter for
so I just saw him yesterday. So we'll fix that for him.
Okay.
Yeah. So I think those are some of the problems. And so getting back to the question, I think that if people know some of the things to look out for, and then report to either their regular doctor, and then come see us, we'll be able to help.
The U.S. could have given you more money. Why Ghana?
Just like my friend here said, we all train. I went to Tech and went to Mayo to do my training in urology. And I've done so many of these complex cases. And people come, same reaction, you're from Ghana. And they are very grateful. And I sit, and at the end of the day, we're all from here. And if we can bring that knowledge and skill set to help our own people, then our success is not complete. So that's the main reason that we're doing this. And mostly to make sure that when our time is past and gone, at least we would have an impact.
Yeah. I wanted to ask that, more pay with the knowledge that you have.
That's right.
What happens is that the person will be there when he dies.
That's it. And then you're gone. Yeah. So if we can, my big thing, if I can impact even 10 people in the sub-region, not just in Ghana, who can do what I do, it's going to change urology forever.
I see.
Yeah.
How can you be?
And in the same manner, right? Yes, some analogies say success is that you're able to pass things over. You pour yourself into others. Because in Sua Entineno, right? And so if we can't pass our skills on, it's going to age with us.
That's right.
And so one of the main reasons are, and say we will have a place that will be able to gather the expertise in one place. I am meeting the training next generation of people. I'll meet my normally abroad.
That's right.
Yes.
But yeah, can I also go sending messages. Access say na more base say sikasemo emu ebe do baby ase no kra won to me man no me ade. Mo sha ase ache.
Oh, ye be 1 year ago. Ye go so ye.
And participation that is saying Ghana for Mumba.
Yes, I think some people are beginning to know that we are here, right? And I'm sure this forum will help with having an akufo to say one and normal, you know. Okay. Yes.
Yeah, na even Mumba complicated. We are high eba no we are doing more. I don't know some mobile
I think we were talking about it earlier on.
That's
so
right.
Maybe you can expand.
So that's very common. That Omubana, they are on so many different herbal treatments. And most of the time, they don't even know why they are taking the herbal, and they've not seen any changes. The situation is still getting worse. And actually, this person who has the catheter for 5 years is on like 3 different herbal treatments. So yes, we've seen that. And so I actually went through to explain to him that the herbs, and nothing against the herbs, but it's not working for 5 years. You have to try something different. And so we're going to do some testing. The first thing for him is to figure out if his bladder is still working. And so there's a test we do to check that. The bladder is a muscle. And so I'm going to check that. If as long as the bladder is working, we'll look inside the prostate to determine how restrictive it is. And then we'll do an ultrasound to size the prostate. And that will give me a good idea of the kind of treatment that we can do. And one of the things that we're doing now is high-tech technology called aqua-ablation, where you use water, pressurized water, to ablate the obstructive tissue, and meaning the blocky prostate, and then creates open channel for him to urinate. And so there are things that we can do to help him.
And it started from how many years?
Prostate. So just to give you a few numbers here, by age 50, half of men already have something happening. And so in the Western world, most of them will be on medication. Half of men by age 50. And that increases every decade. So since we don't have the data here in our region, I think it's going to be very similar. And in my experience, I think the prostates in the West African region is actually bigger. Yeah. Based on the surgeries that I've done.
Is it because it's
likely genetic. Yeah.
Genetic,
yeah.
okay. The black race.
That's right.
Okay.
That's right. And so that's one of the things. And then a big thing is prostate cancer. And so every man from age 50 onwards needs to get a PSA test. The PSA stands for prostate-specific antigen. It's a marker for screening for prostate cancer. And then also to have their prostate examined. And if you do that, that would prevent a lot of problems down the road. And if anything changes, like you develop prostate cancer, you will be diagnosed early in the phase of the disease. So you have better outcomes for treatment. Yeah.
After doing the PSA, is that the word you use?
Yes, PSA.
You have to go ahead and do any other tests.
So based on what the PSA shows.
Okay.
If your PSA is normal, we don't do anything.
And is it within some range?
Yes, there's up to 4.
Okay.
For the average 65-year-old. And then as the age we age, we sort of make a little adjustment.
Oh, okay.
Yeah. So,
At the end, so can say Ghana and then the blacks, I say, is it your eating habit? Is it?
I don't think we know that yet, but there are a few things we know more in terms of prostate cancer. That if you compare blacks in general with Caucasians, our white counterparts, for every stage and grade of the disease, the black persons, although they have the same diagnosis, is more aggressive.
Okay.
Same diagnosis.
But ours is more aggressive.
More aggressive.
Why?
Genetics, yeah. That's what some genes that are driving that. And they're still working on trying to clarify.
So to that point, even say you treat blood pressure, it means say no be better for blacks.
That's right.
Versus whites.
Okay.
And to say research no more yeah for whites I'm on the benefit. And to say yeah data what works for us. The blacks know what works for us no. And then we will always be behind the curve, right? Okay. So for what we are doing, research eventually be a part of it. Yes. The more we see people, the more I church say, okay, when you treating, say, this is the outcome. So when we gather that data, then we can use that to treat a bigger black population. In fact, because pharmaceutical companies, almost say, Ghana, I taking care of black people in Africa. Now they want to work with us. So data ye beje okay. Bit media momo, media ejuma AI, artificial intelligence plays into it, and we will use it at our center to be able to analyze data to say this works better for Ghanaians, West Africans, and this works better for non-Ghanaians or not West Africans, right? And so you tailor your treatment to the people that we are serving.
Apart from Mumbi, did you bring other doctors along? Or
yes, so right now we are the face of WISE, but it's not only us. That's there are other doctors that work with us, nurses that work with us. One important thing, value that we are bringing here, and say, when you teachers, so into me, students are doctors at me training. In at some point, now you students, you want more training here. Because of the impact they think we can do in Ghana, they want to come with us, right? And not that they want to come with us, they have come with us. Say last month, a group of doctors, normally 4, almost free Harvard Medical Hospital, almost by for 1 week. Okay. Another month, another group, free Duke University, another group from Johns Hopkins, and that is the value. Yeah. So school or now for now we train you. That's right. You have to capitalize on that. Until semi-far phone, now me from say, me who will be waha, your center. Jare way no now only world expert, so that's why we are able to put people in the front of world experts. Okay. No much.
What about affordability? Medical
okay. One of the things is that it's useless if you have something that people cannot patronize.
That's right.
Okay. Right. So we are aware of it and we want to make this affordable. There are people who would go, and I know from experience that I have people from here who want to come and get care at Johns Hopkins. I'm not exaggerating. Okay. Last person Obisa Mesano was about 3 months. The hospital catch and said, on fat $400,000 into account mu and some appointment.
Honorable can call ye no brain a secret on one can once a sika obodi no na enrusa samekaya but them crop say doors no.
I am telling you that's what it is.
400.
There is no exaggeration here.
Yeah.
Okay? And when they come, we will be taking care of
400,000.
Exactly. And a deposit.
Deposit.
A bit more above that, right? We are nowhere in that neighborhood, right? So we make it very affordable for people. Okay. The second thing is that we want to make sure that is sustainable, meaning the money that we get from it is going to maintain the place, pay people, and give them their livelihoods. One of the things is that the whole world is competing for talents.
Yes.
And there's a doctor, nurse, waha, or they training
yes.
And it's like a leaking bucket. You train you be normal, almost a little bit normal. But if we can generate enough funds and pay people enough, our more family around them that they can develop their livelihood, they will prefer to stay and work here. So we need to be able to balance affordability with sustainability. There are a few people we know absolutely they cannot pay for the services we have. Foundation.
Okay.
Foundation why supporting Kofosa. And I don't know, me call me patient ho. My ye bibi amana ne niaso se ohun akwala bi wo Ghana or yare we ye ne surgery e will be cost $10,000 obetimi aboa. Right, and with that we can use it to help those kind of people.
My ending common fa baby are specialized.
Yes.
And nema hodoa so be tie na wa hunu bia e science e wo say quickly otumrika no be hum.
Okay. Enti woju na hu wonim wo head region na bibia e betimi yare bia that's what we do. So for example, there will be a friend of facial paralysis.
Okay.
Facial paralysis, that's when you stroke. When you okay. If you were why you warm on a son of Motier. And the catch of said there's nothing that can be done. If you also have surgery or sorry, none in much here. Obisu or we're fine. Or that's sorry or share associated movements, Menino, Mentiming Catamini, Mentimin, a friend of facial paralysis. And no masana yet me. Okay. Another aspect, yes, can also also mean who had the antenna macoji glasses. 2 weeks later, glasses na nyama kasasano. 3 months later, na makosasano. Bibi says here, na chese be a bibi if you 3 months. E pushy when in it. Into the womb. And it's also some glasses sa. So go home. Obine check it. Until you can check here. Sometimes one say tumor be. Utinum, center of the head, right? And be it me, the camera showing my business. But you see, Ghana, because you are no, you're biting you. Yet the camera and show him, it me qua ni be ni and I can say, and ra, ye bakumo, or be another ifra, I and Ikuhuna no pay or say. Take hours. It depends. How much too long there is. No such surgery maybe a bit 4 hours. Other than that, say your children it's anywhere from 3 hours going. But the good thing is that because I minimally invasive, the empire with 3 minutes. Not just say, I just it's been okasa now nanti now did no back to the things like that. It more almost on in theatre. It me and Noma babak. And you'll be so train too much now, affecting them, and say different way. One common thing is that almost no, almost okay. Ushan Croman, I just won't day. And also it me a young woman not in common as well at nature with me. Okay. Yeah. So things like that.
Okay. And will be 18 and said, no person Obama say why.
Okay. So we call internet website or website. We call type wisehealth.com.
Wisehealth.
Wisehealth.com. So wise na WISE. WAISS, right? .com at Overcall. And a number now out the friends.
I don't know 1% more specializing in top doctors in the world. 1% by joining government facility.
Oh, there's nothing wrong with the government facility. So the normal specialties ni say okay. Some are Juma Kakra will come for nochi charity basis. Every 2004. Tibi ni normal or more our more the womb. Oh, and I'm a normal Kakra will Kolebu. And Tibi says okay, Kolebu come for nochi gaps say no. And only a person filling those gaps. So we don't want to take away from what the government. I said we want to add to it. And we are looking for collaborative efforts. You all say you confirm Kolebu ENT doctors no 18 years no my and so it's a very collaborative effort.
Right, Dr. explain to us. Area on social science event like he was explaining. Things are not well.
Yeah, so some include difficulty urinating, urinary frequency, urgency, waking up multiple times during the night, and also moja.
Okay.
That you have to see the doctor right away. Those are going to be the most common symptoms.
Oh, okay.
Yeah.
Okay. What about the cost?
And the causes, there's multiple. It could be a prostate problem. It could be kidney. And when I talk about kidney, it could be kidney stone or even sometimes kidney cancer. So it could go from something that's benign to something that could be really serious. And then some people who smoke a lot also develop bladder cancer. And so if you are a smoker, of course, and you see blood in the urine, you need to see the doctor.
Okay.
Yeah. So those are going to be the common things. And pain is usually more related to stones. Yeah. So kidney stones are very common. We are finding out here and we have all the technology to take care of people.
Okay. Well, what about the affordability?
Same thing like he was saying. We are in the same building and we use the same concepts. And so I think to add to what he said, just if it's cheaper to get some of the things that we use into the country, it will help a lot. Because that's some of the issues that we face, trying to get our equipment and items that we use on a regular basis for patients. Yeah.
And this one says, a wide open university, how affordable are their services? Are they for the common man? It means even people with glaucoma can see them.
Okay, good question. Glaucoma is not an area that we have focused on. So we haven't focused on ophthalmology yet.
Okay.
Because initially we thought ophthalmology care is available in the country. If we begin to see, there is a need for us to bring experts for eye or ophthalmology to bring current technology, we will do that.
Okay.
Yeah.
And this one says, very important discussion. I commend the two Ghanaian doctors in your studio for the kind of positive mindset they have. Their love for Ghana is to many successful Ghanaians with special talent in the diaspora. Their love for Ghana is alien to many successful Ghanaians with special talent in the diaspora. Tell them I will come and visit them soon. So book an appointment for me. Good job to your production team. Okay, that's it. Once again, maybe I'm going to say
Oyarifa.
Okay. Now can Google Map be a
Yes, so near can website.
Website.
So we'll see www. What type of Wise Health? Wise Health.
Oh, okay. Madam was senator Adiaba. Nafi the uncommon economy and Franco Trading Enterprise for Adaroma between 4 Bonona Aduma a day and day. This discussion at the bro Franco Trading Enterprise for 7 countries, one more phones and accessories. Franco air conditioner, one more tabletop fridges, one more beer mafia come to say iron, afi ope eye kettle ato saa nneɛma ɛte saa ne nyinaa no kɔ Franco a wonsa ɛbɛka bi in fact Franco nkoa na ɛyɛ company organ ha say a product bi na ope ho kɔ na ɛsi ebi ni hɔ a the next 24 hours flight free baabi a product no wɔ no ba no na wonso deɛ no ɛka ɔyɛ aka ɛhyɛ no so sɛ ɔmo CCTV cameras a wonsa betumi aka bi na no nso ɔde abɔ ɔdwapadeɛ ɛho ban ebe install ama wo phone so ya install nso ɛde ama ho ɛwɔ adwuma na wo mu no ɔmo nneɛma ne nyinaa ɛyɛ kama okɔ online www.francotrading.com am sabe ka ɔmo nneɛma ne nyinaa na aka ya hyɛ so to bi wie na apɛsɛ yɛn famrewa ɛde bɛbrɔ wɔnom main office no adabraka ne Roxy cinema ne hwɛ anim obi nso osu ɛbɛn ɛyɛ Unauthorized ɛwɔ circle ɛna obi nso osu yɛ no nso ɛwɔ Oxford Street ya no aka ya hyɛ nso Madina nso ɔno obi ɛhɔ nso onsa ɛbɛka bi ya no aka frɛ 0555939311 0555939311 Franco ɔsi phones papa fie Dr. Boahen meba ho enkomo a yedie nyina no ebetumi aba sɛ wan so wa observe nneɛma bi oba Ghana ha sei wo bibi sonko a person ka kyerɛ the Ghanaian community no manintio.
Okay, the main thing as a boss say Ghana you won't for right, you won't for, and I can tell you said they all are here and they are also outside. For those of us outside, our love never left us, and we really want to come and help and contribute. And if the environment is created to make it conducive and easy, say we will have people.
Okay.
Yeah. So help is here. Yes.
Production and yet ready, me course kakra to listen to the omo 80 no. Enti one kind of mention and so emfa mame. Doc, mame braho. What observe BBA you want to tell the Ghanaian community?
I think to improve your overall health, I just want to make sure that we all plan on making sure we're drinking adequate amount of water, eating vegetables, more fruits, and less sugar, salt, and animal protein. So that will be meat, chicken, fish, nyama. Less of that.
Animal protein.
Yeah, less of that. But more vegetable, fruits, your water, and then less sugar, salt, and the rest of it.
Why less of the animal product?
So if you think of it, as we get older, we don't need protein is for building.
Okay.
Yeah. And we don't need that much protein. And then it creates a lot of strain on the urinary system, especially the kidneys. So I think that it's very important to balance things as we get older. When children are growing, they need all the building that happens during their development. So it's okay. But as we become adults, it's very important to maintain that balance. And especially if you want to live long, you want to make sure that you have all the minerals from the vegetables and fruits. And then make sure you are hydrated and minimize the effect of salt, sugar, and then processed foods. I forgot to make processed foods.
Okay, processed foods. Okay.
And then protein.
Oh, okay, right. Doc, mama, more bano. Yeah, September. Yeah, they been more cancer. Oko na wakushinya de na opeso babebua acceptance. The Ghanaian community na accept na difficulties kakra. More facing challenges.
Oh, you know, the challenges are always going to be there, but we turn a blind eye to them.
Okay. We
joke. Say, Obio co school kai be a friend of quadratic equation. Quadratic equation. There was two variables. I say y and x. You say y now we say na we manipulate x na no nya y. Now quadratic equation. I almost say plus c constant. Constant no. And then the problems no. And you say no whole. You are factored in. Okay. Yeah, we are only interested in getting why, the outcome, our vision, that we will pass health systems here until we know it's there. I mean, if it's going to be made less for us, that would be great.
That's right.
But it's not going to stop us from doing what we want to do. Because in the end, the impact factor, it's much greater than the challenges that are in front of us. It's not been easy. Yeah. So in general, to make have they accepted it? I would say my short answer is yes.
Yes. Somehow. My uncle Humano so 0245638748. Mama Kwaiman Penny for Omo Person Omobusa, a doctor see in Semno, Omo Frena Omobusa MI 0245638748. Mofan Chem 0240550899. 0240550899. I don't know airline you use. Hello, good morning.
Good morning.
Boko di openi. Okay, that's my own so kakra na busa wasemai.
And Kencity tema.
Tema, okay.
I let me see more push. They will say that it's not for me.
Manti on kai o manti on kai.
Me see they will bedroom for prostate now. A bit matter for me.
Wait me up for me. We a prostate surgery no a. Yeah, Emma Oberman Tofom. That's the question. Okay, that's it. Me just say Dr. Kono ebe is asem na 0240550899 0240550899. Be ma bia be ma ho asem nya no. Okay, hello, good morning. Hello, good morning. Hello, good morning. Okay, we're free. So 0240550899. Hello, good morning. Oh, no, so free. So line no ya ha dwen kakra. But the doctor no after surgery, prostate,
Yes.
can you perform?
So it depends on the kind of surgery.
Let me finish with this. Hello, good morning.
Good morning.
Me da say baby I say free na yentio.
The person is free executive.
My yentio.
The rest. The patrol. I just said, just say, we say kidney and worker. We not do say worker. Simple.
Okay, me da say we yedi ho come that about me say she's asking of symptoms about say kidney ho aka what are the symptoms e be ma to me aka ho asem me say we di ho come that about e brebe mo be san team
Okay.
The my ear kwahma no so 0240550899. Hello, good morning.
Good morning.
Me da say wo kasa free
Nikata Teshi.
Teshi, yes, mami too.
Me I think it's me last year. No. Me finish like daily.
Unya dey last year.
I mean, I think it's me December to delay.
Unya symptoms. And how are they?
Now me so fully like daily.
Just all you should have no.
And me see me who find it up now. But the determine say, is it nice to take it or anything?
Interesting. I also say a call. No one tested here.
No, I know that my test
Me da say over here no e dey amount. Doc, you are on my performance after surgery, no?
Yes. So there are two kinds of prostate problems. We have the benign prostate, which is usually due to enlargement. As we all get older, it gets bigger. And so the surgery for that doesn't involve removing the entire prostate. We just remove part of it, the part that's causing the obstruction. That has less risk for erectile dysfunction. Yeah. But the cancer diagnosis, where we have to remove the whole prostate, depending on if all the nerves for erections are saved, may impact the erection. So I do a lot of those surgeries.
Okay, my main faculty, Messiah about. So, hello, good morning.
Good morning.
May I say, okay, free?
Nikata Akanda.
Akanda, my into you.
But I found Dr. Okatano. No, can you say there are some problems that bring to one bit tight now. From which I tell you, from which I can tell you, we need to make me Jano. Well, what I would like from a high said, most of hospitals are looking for women. Oh, that's going to show now, what part of a Gapuma? It is how much me. I check home, I do a Gapuma, a Gapuma, no more canal.
Okay, let us say on the observation, if I hospital I have a problem, or they were observing, they say most of the facilities are called, they say glaucoma. Hello, good morning.
Hello, good morning.
May I say?
Morning.
Okay, sir, free. My into.
Good morning.
Good morning, yes, you. Why? Yeah, that's it. My into.
Because now maybe that Miss Queen at Prostate 5 months today. Now, you check up on your day, and Chebia no Sabania stroke come. It may be such a anchor, Medina or making a boy and after on number so into that. Now, you baby or more, I tell you they are.
Okay.
Remember, when you're stroke, you know, it's a half by a week,
okay.
And a process in so, and such a unbetween a boy. Don't know what I'm into Ghana. You
Benjamin Bosombrawa Boba, he says, please ask them whether prostate can give you lack of ejaculation and strong libido.
So the prostate by itself doesn't do that.
Okay.
Yeah, it's some medications that we take could cause lack of ejaculation. There's a very common medication that we use for prostate enlargement that, if you think about it, the medication relaxes the prostate and the ejaculation comes through the same channel.
Okay.
So when it's effective and opens the channel, when you ejaculate, what happens is that the ejaculation comes through, but because the channel is wide open, the bladder is right here, so everything goes back into the bladder. So when you urinate after ejaculation or after sex, you notice the urine looking cloudy. That is the semen that's now coming out. Yeah. Okay. So you are still ejaculating, but it's not coming out. We actually call it retrograde ejaculation, meaning it's going backwards. And that's usually effect of the medication. Now, there's also surgery to undo the blockage that I mentioned earlier. That will also sometimes cause the same thing. The newer versions of surgery that I mentioned called aquablation is the only treatment that doesn't cause any of that.
But as my main fact, we chat to answer questions and I feel common run away. Hello, good morning.
Good morning, Obama.
Me way now, so I can say free.
Obama, we touch our Uber Cope, your son to be
my into
you. Obama, a doctor, I can say, in Chrome, which me, with me, I'm sharing with you. Now, the same business, a Yabuano. What are the causes of Agyapong in common? No, I don't know
Doc, what my focus is here now. Questions not my busano a dose. Snoring.
Yes, snoring, your friend, a pandemic. Ghana it will be okay. Normally, no. So noisy.
Okay.
In this, there's a problem. Okay. What that means is so dana humia and from on into me in fact with minimum and cofa with minimum and call with lungs moon into a force so alcohol. I said the wind storm. Say in Zubi Betono to say in Famaneba, sir, then Famane Fano, in Yaquine, into the Bibiawobiana, a versatile vibrating. Till what we numono say, you need vibrate here, and then they snoring.
Okay.
In the snoring, just the sound to tell you, say, something is not right. Okay. So usually, no, we have to check what is not right. The important thing is, so what Dana say, Ubrain no, oxygen na nature say brain no e be nya no multiple times into wo da ultimate da 8 hours we be sorry no still my brain so wo drive here wo so do traffic light na wo tonko obi ni wo bon komo no na wa attention no any ho slowly no na wa koma na e say e work harder to send blood to your brain until now blood pressure no e cost so over time now we gain weight now we untiminya active now blood pressure na e cost now why dull then it leads to other problems.
Yeah.
In this a snore, I say you check if you say, is the problem just the snoring, or do you have something we call sleep apnea, affecting the way I would know, and then we need to treat it. There are different ways to treat it. No, usually nature say blockage be. Okay. Inti say wo kasa na say wo home the same time na ye challenge wo kasa no ntimi home mfa wonum ena wohinum no so a block inti sa na e ba na sa
dog ni no cancer ni kunu when stroke still a prostate.
Yes, yeah, details from what kind of prostate problem or warranty, but one thing I want to say, so who was stroke in addition to prostate problem, it makes it more difficult. Yeah, but I think if she can reach out with him, we can figure out
she was asking of your numbers. What the numbers in the okay.
Yes, okay. And then we'll leave the numbers and then.
Okay. Now, stroke, prostate, linkage.
And the way the brain works. So, if I feel the sensation to go, I'm on the program. I can't go to the bathroom.
Yeah.
So I'll send signals from my brain
that wait
to wait, and then my sphincter will tighten. Once you have stroke, some of that is lost. The control is lost. So now my bladder feels that sensation, and I can't control it. And some people will just leak urine and wet their pants.
Okay.
Yeah. So those are some of the things that would happen. So if they are not even to the point of leaking, they'll be going to the bathroom every 30 minutes or an hour because of the stroke. Okay. And there are medications that would, it all depends on what the prostate problem was, and because it could be a benign problem. If it's prostate cancer, it's also different. The treatments are different. Yeah, so that's the part that we need to figure out.
Doc, apart from the MOK,
oh, no. So you were pain specialist.
Okay.
Yeah. And it's a big problem. The people cannot walk. They have back pain. Surgery. So they are always in pain, neck pain, shoulder pain. You were interventional pain specialist.
Interventional pain specialist.
Correct. Different things. You see X-rays and fluoroscopy and ultrasound to find where the pain problem is, and then they have some radio frequencies that they use to try to kind of dull down the pain. Sometimes they will actually implant things along your spinal cord to help with the pain. So we have pain specialists, and we have a slew of medical doctors. Our medical specialists are almost second opinion.
Okay.
And this, for example, say, diabetes control the NASA opinion, then we'll give you a doctor there to help manage those things. Okay. So yes, not only our two specialties.
Okay.
Yeah.
The problems apart from pain and
so pain, urology problems, neurosurgery, plastic surgery, ENT issues.
Plastic surgery, the kind of offense will be
oh, plastic surgery, nature say, baby, akobasa, near pesi, you're correcting. And only reconstructive plastic surgery. Say, ebia, unya car accident, would join nebu, and a scar will win it may fix it. Ebia, ukoye surgery, you wabodge, until was senachia. Yetimi ndumpi free wo nine near the bay new aboard ebia cancer nti ye twa wo hene anase ye wo no bibia mfifi ye ene plastic surgery. No, of course you were plastic surgery obi say only me very active me ejuma wo bank I say me very presentable all the time nti bibi fifi me kono and very youthful they said me tie no me when no me nyame papa feel too flat and say me pija na kakra and no cosmetic plastic surgery. So that's part of what we do.
There no some year ho adwuma.
And so yeah.
Oh, I see. I see. Dr. Akono, mama you wan asem we chat we are almost done. Whatever you want to say, your last word, so that
I think that just that urology, we are open to see every condition related to the urinary tract. So people with kidney stones, prostate problems, erectile dysfunction that affects men, and kidney cancer. I actually, what I was going to say this, one of the things we did since we started, we'll be doing laparoscopic kidney removal.
Okay.
And patients leave the following day from the hospital and they go home. In the past, when you do the open surgery, they are here in the hospital for sometimes up to 2 weeks.
2 weeks?
Yeah.
2 weeks,
and
3
then,
weeks?
Yeah, and it takes a longer time for them to get back to work. So we have all the technology and techniques here now. So we are open to take care of them, so they can reach out to us.
Okay, Doctor Okan wants to be too technical.
So, the summary is that anything at all affecting urology, I say, oh, just a quabrocini, no,
kidney,
no,
okay.
First surgery, be a hospital, no. First surgery, yeah, na obianka or tnaplane moon the next day. I call India, also call India. Be catching so program be said, you be a hospital be no afraid. And say, you bit my and say, you bit my tea on any very first surgery, yeah, hospital. Champagne through a tiny opening near ye kidney, addiction or coffee. Yeah. So in general, anything you can think of at all.
It's a name how do I they call US here, they call South Africa. Those days not South Africa wumpa. Na say I switch I shift to India.
India.
India. Ninga na bar. Plane ticket to cry to meet you at your camera. Correct. Mammy, you are not a chat.
Okay, well, yeah, that's a passy. What my requirement about in but you see you who say, who say, Yaba, if we have near the Yapasia Boa, and they should reach out.
What telephone number? One come.
Yeah, telephone number, dear. Mean kind of offhand, my main said, my main trying
people want to call.
Yes.
Or more access further questions.
Let's see.
Because there can and you be behind it me and who said be no crash or frame me phone.
Okay, yeah, sure.
Allow na Yakwan Fabra fee. Oh my number na fee or more or my ready say on per se.
Exactly. I think I can find it in no man back here 050 965 1116.
Okay, because maybe I should say your private number.
No, where your hospital number.
Yeah,
hospital number. 050 965 1116. Okay. Your WhatsApp. So
team view, man.
Okay. 050 965 1116.
Sure. Yeah, that's a point. More person more free. Bisa. More free. Say hospital.
Yes, hospital.
That question be on person.
Correct.
Okay.
Yes.
Dr. Bohan, that's all right.
That's part.
Dr. Akono, thanks for coming.
Yeah,
that's for honey arrangement. Is the doctor see what problem I'm Mr. Fako no mo share emfa ema. Esan say what na ho be wi ase na sika no ya na eye kese. Production team. Ena mo nyina mo ase nyame ya admo channel pa ebihia. Yakra.